So FENIX is going to show us how this is done. She's going to come in and just gently lie down. And you can see she's just finding that. Do you have the point there? Okay, and she's getting some radiation down the low back. Now by rolling onto it, rolling her hips over, she can put more pressure on the digit. She can roll more onto the digit and apply deeper pressure. She holds that for 1 to 2 minutes. As that pain starts to dissipate, she can actually go into it slightly deeper to get into deeper fibers of that trigger point. Don't cause yourself undue pain. Just you'll get a sensation of radiation, and then you should get a sensation of a melting away of releasing the trigger point. Is that lit up there? Okay, great. She can then move just in. Now, those spinous bumps that you feel, you don't want to put the digit on that. You put it right next to that, and she can apply pressure to the thoracolumbar area. And that may radiate down the spine. Now, what's important about this is that she may be easily finding the active trigger points that are causing her pain. But she needs to move around, maybe slide up a little bit, and right below that, she'll find one that she wasn't aware of. That's a latent trigger point. It wasn't creating spontaneous pain, but as soon as she applies pressure, she feels the radiation. And if you refer back to early part of the presentation, we talked about the difference between active and latent trigger points. The active trigger points are easy to find. She can move up again and see if there's another one a little lower down. The active trigger points are easy to find because we can reach back and touch them. They're hurting us, they're causing pain, but we need to search out the latent trigger points. Those are the quiet ones that are firing into the spinal cord, and if they're not removed, they'll reactivate the active trigger points. This is why trigger point therapy many times fails, because only a few of the active trigger points are released. So she's moving around, searching out all the trigger points on the side of her spine. She can go all the way up to hit that lumbosacral area. Again, she moved to the point where she is now moving into the lumbosacral. She first started out here in the soft tissues of the quadratus lumborum and longismus muscle, and then she moved in by the spine into the thoracolumbar. Then she worked her way down the spine, checking out all the erector spinae muscles along these spinous bumps. Don't put pressure on those spinous bumps. That will create irritation and not affect any therapeutic change. Now she can move into the gluteus medius. That's right out in the buttock. Again, the gluteus medius is right out here in the pelvis. She's been able to treat trigger points up and down, and she's going to move just around a little bit until she's searching out for latent ones. Again, the active ones she'll be able to go right to because you can point to those. They're actively stimulating pain. Again, I want to emphasize on moving around to deactivate the latent trigger points that are quiet or latent.